Hello, welcome back to class. I'm sure you did enjoy the macronutrients, the 3 macronutrients: carbohydrates, lipids, and proteins. Yes, the other group of nutrients that are important to the body, you have the micronutrients. So today we shall start with the micronutrients and basically vitamins, but I'll give you an overview of all of them. So our learning objectives is that you should be able to classify the micronutrients and give examples. List the fat-soluble and water-soluble vitamins. List the vitamins of global health importance. List the food sources of the vitamins. Discuss the effects of processing on the vitamins. Discuss the functions and roles of the vitamin A and folic acid as they relate to the human body. Explain the significance of vitamin A and folic acid in maternal and child nutrition. These 2 vitamins are key in maternal and child nutrition, and they describe some of the characteristics of the water-soluble vitamins. So at the end of this class, we should be able to do all these things. If we are not, then it means we didn't pay attention. So pay particular attention. So what are micronutrients? These are nutrients that are needed in smaller quantities, as opposed to the macro. Macro meaning big, micro meaning small. And the micronutrients are basically divided into 2. They are the vitamins and the minerals and the trace minerals. In some tests, you don't find the word minerals, you find the word elements. Is the same thing. And one particular characteristic about the micronutrients is that they do not provide energy. So the energy giving foods are basically the macronutrients. The micronutrients do not provide us with energy, and their major food sources are from fruits and vegetables. That is why the Ghana Health Services have coined them to be the protective nutrients. The protective nutrients. These are essential to the body. What it means is that the body cannot synthesize them. They have to be present in the diet, the food that we eat. They are important for all body functions. They are important. They are important. They play important role when it comes to formation or synthesis of substances in the body. For example, when we are synthesizing our glycogen, the carbohydrate storage form of starch or glucose, that is glycogen, we need these micronutrients. They also help in protein synthesis. They also help in formation of fat, different types of fat. And also when we are breaking them down to be used for other bodily functions, especially for energy. We eat the food to get the energy. But the food that we eat, the kenke, it is not the kenke that is going to give the energy. It should be broken down. And we need the micronutrients to work as coenzymes and enzymes to perform these functions. Yes, there are quite a number of the micronutrients, but there are 5 micronutrients that has been identified of global health importance, basically because of their special needs by women and children. You know, all over the world, women and children are known to be vulnerable, when there's any challenge, yes, to be vulnerable. So out of the challenges that women face, especially those within the maternal age between 15 to 45, yes, they've seen that there are 5 micronutrients that play an issue, and we shall talk more of them. Reasons why they are a challenge: that wrong food choices. People are not eating or selecting the right foods. Food preparation methods are not right. We do in Africa, we do overcook our food. And sometimes too, we cook in large quantities of water, then we throw the water away. As we throw the water away, we are throwing away the nutrients. When it comes to absorption, they are also poorly absorbed because of some of the cooking methods and some of the things that we've added, we've adulterated them, therefore they cannot be used. And then there may be other individual genetic disorders that may also influence the absorption of the micronutrients. Yes. What are these micronutrients? The 5. We have 2 to be vitamin, 2 of them being vitamins. We have vitamin A, which is a fat-soluble vitamin, and then we have folic acid, which is a water-soluble vitamin. These are vitamins of global health importance. And then the minerals, you have iodine, iron, and zinc. And these three are trace elements. They are trace elements. And when we talk of the vitamins are divided into two major groups. We have fat-soluble vitamins. What this means is that they can only dissolve in fats and oils. Fats and oils. So without fat in the diet, these vitamins cannot be absorbed even when you take them. That is why even when somebody is on weight loss regimen, we cannot take fat away because of the fat-soluble vitamins. Then water-soluble vitamins. These are vitamins that are soluble in water. Soluble in water. So this tells us something that when we cook them in large quantities of water and we throw it away, then we are throwing the vitamins away. And because they are also water-soluble, they cannot be stored in the body. When we eat in excess, we urinate them. Like you sit down one day, then you eat about 10 oranges. You are getting vitamin C. Vitamin C is water soluble, but you urinate everything, work than zero. Fat soluble vitamins, because we store fat, the fat soluble vitamins are stored in the fat tissues. So when we have excess of the fat soluble vitamins, we store them, and that can lead to toxicity in the body. So these are the two major differences between the fat-soluble and then the water-soluble. Yes, with the water-soluble vitamin, generally we say we have vitamin C and then the B group of vitamins. The B group of vitamins, yes, vitamin C and the B group of vitamins. You realize that I have folic acid in a different color. Why? Because it is one of the micronutrients or the vitamin, water-soluble vitamin, that is of global significance. That is why we are having a lot of challenges with folic acid globally. So it is not even Ghana alone. Even in the US, they have it. It's a serious challenge. Folic acid deficiency is a serious challenge. So we shall talk more about that. And then when we talk of the fat-soluble vitamins, we have vitamin A, D, E, and K. ADEK, for short, ADEK, easy to remember, ADEK, vitamin A, D, E, and K. But the one of global health significance is vitamin A. Vitamin A exists in different forms: retinol, retinoic acid, and retinaldehyde. These are all from animal sources. But beta-carotene or carotenoids are the plant source form. And when you come to our part of the world, we depend more on the beta-carotene, So this is a challenge for us. It is a challenge for us because conversion is not 100% and it's not one-to-one to the retinol that the body uses. So we shall talk more of it. Vitamin D is not a challenge, but right now in the West, it is a challenge. And since it's affecting the West, they have other sources of getting it. They have done a lot of food fortification and so forth. So it's not a challenge for us because we have the sunshine. It's a sunshine vitamin, vitamin D. However, studies are showing that in Africa, we are getting there because with the onset of video games and whatnot, we don't see our children outside anymore playing football, playing gutter to gutter. I mean, the ladies playing ampe, tomato, all those games are no longer. Everybody is hooked inside with the phone and video games. Therefore, they are not being exposed to the sun. So I wouldn't be surprised if in the next future, WHO declares vitamin D also as a global challenge, because in the West it is already a challenge, but since it doesn't hit the developing world, WHO is not coming out yet. Vitamins, what are some of their functions? Very, very important. Yes, for every individual organ, they play major role, as I mentioned, as coenzymes. They are the main source for pushing all metabolic processes, breakdown and formation, therefore essential for growth and maintenance of all bodily process. So this tells us how vital the vitamins are when it comes to young children who are growing. And then for adults, for us, we are maintaining. So in relation to size, the children need more, but for us adults, we just need a little bit to maintain. But the children need it for growth and at the same time to maintain so that they do not fall sick. Yes, vitamin A. So now we are going to take the vitamins one after the other, the two that of global significance, that is vitamin A and then folic acid. Where do we get vitamin A from? From animal source, as I mentioned, but that is not our main source here in Ghana and the sub-region. Plant sources are the major one. for us, the beta carotene. We have it from carrots, from all green leafy vegetables. All green leafy vegetables. We have it from boma, ademe, you name it, boko boko, alefu. But some of these things, we kick them. Don't you know? So we don't have a challenge if we are eating these things. Because some of them we don't need to buy. We can just plug them anywhere along the roadside. Never feel shy. Bend down, plug. So educate our people. Then we also have palm oil. Now, because of globalization, we also have pumpkin and the rest, and the different kinds of peppers. They are all rich. The colored vegetables and the fruits, they are rich. Pawpaw, rich. Mango, rich in the carotene, the beta carotene. So we need to eat them. And one interesting thing is that because it is fat soluble, they are stored with the fat tissues. So during the lean season, we can still have some that the body can lean on. And it is against this background. That is why when Kwame Nkrumah, in his wisdom in those days, in the 60s, he made a law and mango trees were planted all over northern region, because that is an endemic area of vitamin A deficiency. And then the current generation, we didn't know the use of the mango trees. We started cutting them for firewood. But my recent visit there showed that they started planting, because vitamin A deficiency up north is very high. So we need to encourage people to eat our colored fruits and vegetables so that they can get the vitamin. Found in animal foods I've mentioned, but that is not our major source. Plant sources are our major food source. Dark green leafy vegetables, wonderful. Colored fruits, wonderful, but it is affected. I mentioned earlier on that the way we cook our foods, processing, affect them. And vitamin A in particular is heat, labor, and also sensitive to the sunlight. So sun drying of some of our leaves shows that everything is destroyed. So you'll be eating the leaves, although it looks green, there is nothing in it. There is nothing. So sun drying is a way of destroying the beta carotene, and therefore makes the leaves to be deficient in the vitamin. Yes. Why do we need vitamin A? Very, very important. For vision, sight. Sight. So some children are born not blind, but out of ignorance, they become blind because parents fail to give them vitamin A rich foods. It is also very, very important. Vitamin A is needed for reproduction. And especially for men, it plays an important role in spermatogenesis. So vitamin A rich food is very, very good. Vitamin A also plays an important role for growth. Growth, because it boosts protein metabolism. And then when it comes to infections and infestation, it is also there. Vitamin A deficiency leads to increase in infections and infestations. And vitamin A also plays an important role when it comes to iron metabolism. Iron metabolism. So wherever we see iron deficiency anemia, we also see vitamin A to be a problem. And then when I talk about the growth, I also mentioned that you need protein for growth. So even without protein, note that even if you have a lot of vitamin A, you cannot carry the retinol in the body, because protein is needed to carry the vitamin A to the sites where it is needed. Yes. So vitamin A is very, very important. Toxic levels above 300, but as I said, we are not getting it from the animal source in our part of the world, so it is not a challenge. We are not realized, but we should be aware that that potential is there, so that those who are now trying to shy away from eating, I don't know what is becoming of us, some think they can live on supplements and are taking some of these supplements in high doses. We need to educate them to know that they should be careful with the fat-soluble vitamins. Otherwise, they will reach toxic levels that can be harmful. And then when we look at the various age groups, there are recommendations that we need to live within by the age group. And once we eat, and we eat enough of our grains, we will meet the recommended daily allowance for our vitamin A, and there wouldn't be any deficiency. Yes. Yes, since it's a water-soluble vitamin, its metabolism, digestion, and absorption are linked to fat. are linked to fat. So if there is no fat, then it means vitamin A absorption and digestion is that will not go on properly. So it is very, very important. Anything that has to do with fat, all the fat soluble vitamins are linked. So if there is a challenge that the liver cannot provide bile, then fat digestion will be impaired. Of course, all the fat soluble vitamins will also be impaired. And I've mentioned the retinol binding protein, also very, very essential for its movement within the body. And then with infections as well. Primary deficiencies are due to inadequate intake. Yes, when we refuse to eat the greens. Yes, when we overcook the vegetables, especially contomere. If we cook and then the color changes from green to brown, we've destroyed all the vitamin A in it. So anytime we see any green leafy vegetable, the color changes from the original green, fine green color to another color, then note that we have destroyed the potential beta carotene, the provitamin A in that leafy vegetable. It is very, very important. The same way we cook the carrots and then the color changes. And sometimes you see the color in the water, meaning that, and then we throw the water away, we've destroyed it. So it is very, very important. Yes. And then also another important source of the vitamin, which is critical for our babies, is the breast milk. The first breast milk that comes out, which is thick and yellow, the colostrum, is rich in vitamin A. And it's also rich in immunoglobulins. Therefore, we need not throw it out. We need to encourage mothers to give it to the child. That is why it is a recommendation that the child is put to the breast immediately after delivery, so that the child does not lose on this vitamin A, which is very, very important for sight, important also to protect the child against infection. So vitamin A is very, very important. So secondary deficiencies are also due to chronic malabsorption of lipids, and I've mentioned that anything that affects lipids affects that. Then chronic alcoholism, and then anybody who also deficient in zinc. So zinc interacts also with vitamin A synergetically. Therefore, we need to look at it. And zinc also is an element which is of global health importance. So impaired vision, blindness is very common, yes, and that has been a major challenge affecting thousands of children, millions of children yearly across the globe, and more in developing countries. Immune system infections very high all over. Reproduction to abnormalities also very common. Yes, contribution to growth failure is also very common, and then also risk of anemia. And I mentioned earlier that as we manage iron deficiency anemia, we also need to look at vitamin A status of the person we are dealing with. Yes, so that if you do physical appraisal or clinical examination, we look in the communities or patients come to the hospital, sometimes we look on the eye, then we see the beta stop, that white patchy foam there is beta spot. It is white, which we see on the white part of the eye. That is a sign that that person is suffering from vitamin A. And if nothing is done at all, then the eye becomes totally destroyed. So sometimes parents are the cause of the blindness that the children suffer out of ignorance. So as nursing students, we need to understand it, so that as mothers come to the antenatal clinic, we give them the word that they need. And WHO has classified the stages of the deficiency to us. When it occurs at the beta spot level, one can easily work on it and then reverse it. But if we sit there and it gets to cornea, xerosis and so forth, then it becomes a challenge that it cannot be reversed. So people of greater risk include children, pregnant women, lactating mothers, and then the elderly. Why the elderly? When people become elderly, they are isolated in our part of the world, and more so we know with our superstition and whatnot, we link them to all kinds of witchcraft and all kinds of funny things. So they are not fed properly, especially where they are immobile. So that is why the elderly is also a group that is at risk. Toxicity is not a challenge, except when people are taking supplements. So in our part of the world, it is not likely to see that much. But that doesn't mean that it cannot occur. It can occur, as I said, as people are moving towards supplement use. And then toxicity may also be a problem, and when it happens, because it's a fat-soluble vitamin, when that happens, we should experience liver damage because it will be stored in the liver. There's vomiting, skin rashes, and sometimes if you are light skin, you see even the color of the skin changing. Yes, what are some of the interventions that can be done? Are ongoing. Food and nutrition education is key as a nurse to be able to help mothers. Practice of exclusive breastfeeding. If the mother is eating very well, the breast milk will be rich in vitamin A and she can feed the baby without much of a problem. Appropriate complementary feeding. Yes, appropriate complementary feeding, meaning that we are giving foods that are rich in pro-vitamin A foods, such as giving the child pawpaw, giving the child mango, using the green leafy vegetables to make the foods for the child. Then food fortification. In Ghana now, we have our oils and some of our flours and margarines also being fortified with the vitamins. So we need to look out for those foods, and then sometimes supplementation, that is medicinal, upon doctor's advice. Then we need to buy that. Fat-soluble vitamin A, is a challenge in Ghana and beyond. When it comes to folic acid, it is a water-soluble vitamin. And as the name is folate, from leaf. So the same green leafy vegetables that you are getting our vitamin A from, they are also rich in the folic acid. So you see, one leaf, one kontomire, one bokoboko, one adem, you can get vitamin A, you can get folic acid. You are saving some money there to do other things, pay school fees. So these are the strategies we should use to educate the mothers. Yes, it is a challenge. Folic acid deficiency is a challenge in Ghana. Yes, and this is a problem for us, and it is taking a greater chunk of our health care, because in conversation with the president of the Ghana Pediatric Association, he told me that folic acid deficiency is really making a big loss for Ghana, and they are having a lot of challenge, and because of that they were not able to meet the then Millennium Development Goals because of folic acid challenges. And now with the Sustainable Development Goals, they don't know how they are going to make it because the folic acid challenges that they are seeing in the clinics is overwhelming. Abundant in all foods that we eat commonly in Ghana. Eggs are rich in it. Orange juice is rich. So an orange a day, I'm sure you all know that slogan, will keep the doctor away. So let us eat our orange, our green leafy vegetables. We have quite a number in Ghana. Let's use them. Yes, very, very important. But however, very heat sensitive. Therefore, when we overcook them, we destroy the folic acid. We destroy major functions, important in protein production. So DNA synthesis, it is very, very important. Folic acid is important in DNA synthesis, protein production, formation of blood cells. So without folic acid, blood formation cannot go on, erythropoiesis, and that will lead to anemia, macrocytic anemia. So folic acid is very, very important. Yes. Though the table on it shows the recommended amount as per age group, which and you don't need to memorize, but you can print it and have it by you in your clinic setting. Yes. What are some of the deficiency symptoms? Yes. If women are deficient in that, then they may have challenges. So generally, it is recommended that if pregnancy is planned, a woman should be folic acid sufficient at least 6 weeks before pregnancy. So this means that we need to educate our women of childbearing age to be eating more of the greens and other foods that are rich in folic acid before they become pregnant. The situation even becomes worse when they become pregnant and they don't visit the clinics. In Ghana, it is a law. Any pregnant woman who goes should be given folic acid. So it is very, very important. So deficiency can lead to premature or low birth weight babies. And once you have premature or low birth weight babies, the risk of death is very high. The brain and then the spinal cord are not formed properly because of its role in DNA synthesis, so which we call neural tube defect. Other malformations also occur when there is folic acid deficiency, cleft lip and palate, heart defects, and then limbs are also not formed properly. And I'm sure you have been seeing some of the pictures in the newspapers. Yes, neural tube defects. So this is the spine. If the spine does not seal with the two arrows coming together, then it means there is a hole. And because of that, there will be fluid that will accumulate in the hole, as is shown on the screen. Fluid will accumulate there. So you see a bulging at the back of the baby, which is called the spinal bifida. You know, so the baby is born with this, and then we in Africa we attach superstition. But this thing could have been prevented if the mother was eating any of the grains that we have available before and during her pregnancy. The critical period is before and then the first 3 months, where we have cell division taking place. So this is the neural tube defect. Another form, when the child is lying like this, you think that is the head, but that is the defects due to the spine malformation. And then with the cleft lip and palate, I'm sure you've seen some of these things in the newspapers where people are asking for money to help go through plastic surgery. Yes, that is waste of money, because kontomre boko boko ademe boma could have prevented some of these things. So folic acid deficiency is critical, and it is a major challenge in Ghana and beyond, most of the developing countries. Therefore, as clinicians, it is important that we are able to educate the mothers, show them the food sources, how to prepare them, and how to eat them, so that they will not suffer from any of the disorders. The neural tube defect, anemia due to folic acid deficiency will not occur. It is very, very important that we let them. When we talk of the megaloblastic, then the red blood cells look bigger than normal. So we have the normal on the left as I face the screen, and then the one that is not correct, larger than normal on the right. So we need to avoid this. So read your handouts on micronutrients, and then I will see you next week to talk on the micronutrients, the minerals parts of global importance, that is iodine, iron, and zinc. Thank you. See you next week.